Okay, it's May 15th. Happy May. 2 months into our quarantine. Gosh, this must be like the eighth one I've been doing Friday office hours. So I'm Susan Blum. Welcome to my Friday office hours. So I have to let you all know that this is going to be my last office hours that I'm going to do in a regular way every Friday. This has been great, and I'm really enjoyed my time with everyone, and I think you've all benefited a lot from these sessions. I'm just not going to do them every Friday, and so you're all on a mailing list, and whenever I'm going to do one, we'll let you know. But instead, I'm going to start, because we have a very closed audience here. There's about a couple of hundred people that signed up for these. I'm going to instead switch and start doing Instagram live, um, discussions, right? So I'm going to just change the platform over to social media. This was my team and I, we had this whole conversation about that this would reach more people, and just be able to, offer this information to more people, which is good. Wait a second. Let's see if that lighting's better. What's going on with the lighting? I don't know. Something weird. So, all right. So, yeah, you see that? There's some big bright light down there. All right. Like I said, I have a different setup. It's just really sunny out, which is sort of fun. And so slightly different setup. Yeah, maybe that'll be better. All right. But yeah, look at me. I'm so shiny today. All right, whatever. So happy Friday. I thought that today we would talk about, well, you'll have your questions for me, and that's fine. But I thought that today we would talk about reopening, right? Because that's the main thing that we're all in the middle of right now. Wait 1 second. I'll be right back. It's really bugging me, that whole thing. Oh, I know. Just way too bright. And you gotta go down. There we go. All right. All right, there we go. That's so much better. I'm a little bit of a perfectionist, although you probably all know that about me a little bit. And I just had to make sure my whole setup is okay over here. Nope, the other way was better. I don't know. Today I'm having some problems, so you're all just gonna have to bear with me a little bit. All right. It's really sunny out today. I think that's the issue. And so there's just like a lot of sun coming in through my window today. All right. Anyway, I'm getting tired of this. I don't know about you guys, but like this thing's going on from a long time. I'm glowing. Thank you. Well, I do have to say that I have been, so I put my shades down, but you can see all the sun's coming in. I've been gardening, right? And I actually had trouble sleeping last night because I was sore everywhere from from the work I did in the gardening. I went to the nursery with my mask on, and everyone around here is so good in terms of allowing the customer and to feel really safe. And so that's actually what I thought we would talk about today, because the country's reopening, as we all know, and I want to talk about and have a conversation about venturing out, right? And my sense is that everyone's getting restless. The summer's here, it's beautiful out, and what do we know about risk, and how do we really make sure? It's sort of a fitting last formal session, okay? Is like our formal quarantine period is coming to an end. We're really locked up, and and we're all starting to venture out somewhat. And what does that mean, and how do you stay safe? I think that as June, the month of June come next weekend is Memorial Day weekend. And, next weekend's Memorial Day weekend, which is the official beginning to summer. And everyone's going to want to go outside. And actually, the good news is that we're learning, whereas initially we told everyone, stay home, stay home, stay home. We now know that actually going outside is really good. The chances of getting transmission from someone else that you pass by or that you're sharing outdoor space with is very low. That's not where people are getting infected from this virus. The sense is that you need to spend prolonged time in like face to face with someone, or in a small closed confined area with someone who is actively sick or has the virus. And so when you're outside, outside's good. And so the good news is we're going to just tell everyone to get outside this summer. And so creating outdoor social opportunities for yourself, as well as spending more time outside, or even going when you're going out. I mean, there are places, gosh, where was it? Someplace in Europe, I think it's even Sweden or someplace, they close the streets and they're letting all the restaurants set up on the street outside. All the restaurants are like outdoors. And so there's ways to work with this so that we can create a safer environment. The issue is being in a closed container. And so that will become a really big issue in the fall and the late fall and winter next year when we all are back inside. But at least for the next June, July, August, September, the next 3 to 4 months, we really should be able to find a way to live our lives safely by doing as much outside as we can. So I went to my local nursery and I put on my mask and my gloves, and they were mask and gloves. They had a whole checkout process. They don't even take your credit card anymore. You just read it to people. I only went to the outdoor space to go get flowers. And oh my God, I planted flowers. So I have a new place I do yoga from home. And it's in front of this back door. Like I carved out a little yoga space for myself, and it's in the back door. And I was looking out there, and there's that's a place I don't even have any sprinklers or anything, and there's nothing out there to look at. And so I decided I was creating a new garden for myself with flowers, so that when I do my every Sunday yoga practice, which I'm back to doing now, which is really good from home, that's where I set myself up. I'm beautifying it for myself. So sort of interesting things and ways that we're finding to make lemonade out of lemons, I guess is the way to put that. And so I felt very safe, actually. And I brought Purell with me, and I took my gloves off before I got in the car. After everything was packed up and I was done, I took my gloves off and I wiped my hands with Purell and got in the car. I really work when I go out and shopping and anything, I try to keep the interior of my car a completely clean space. So I don't get back in the car until I wiped my hands, and I don't put anything interior in the car from the outside. I try to put everything in the trunk. And so that's sort of the way that I've managed, but we really are not finding that we're getting transmission from grocery shopping. The people that work in the grocery store that have constant contact, that's the thing. But 15, if you're passing people by in an aisle, you're not going to get it from them. There's sort of this magic number I've been reading, which is 15 minutes of sustained face-to-face contact with someone who's actively sick. And it actually even looks like the shedding period when you shed the most virus is the day right before you show symptoms, the day you have and then the day you start becoming symptomatic, and then over the next 5 days, the amount of virus you're shedding gets less and less and less. So there's just a few really big days that when someone, and certainly the scary part is the day before they have symptoms is when they're extraordinarily contagious. And so that's a bit of a problem because they might not know, that they're doing that. So I'm here to say today, and I want to take you through the whole idea that it's time for us to overcome some of our fear. And what's the antidote to fear? The antidote to fear is knowledge, right? And this is unfortunately what we're not seeing as a culture in our country right now is we're all afraid because we don't know. We don't have enough testing. We don't have enough information. We don't know exactly what to do. And so I thought I'd focus on that today because that's where I'm at. That's where we're up to, right now, is planning to go back. I'm in the process of putting together the guidelines for opening Blum Center. And so that's why this is on my mind, because we're going to open to phlebotomy. We're going to open to phlebotomy starting the month of June. And so June 1st, we're going to start drawing blood again at Blum Center. And then I'm going to move towards we're going to move towards potentially starting to see patients at the office in July and August. So I've been reading everything and making lists of really how to do this safely. And which is why I'm coming to the conclusion, you know, we're all starting to figure out how to open up. And I'm coming to the conclusion that, you know, this is the natural next step and that we can do it in a safe way. And so here's what I want to share with you all today. Okay, where's my list? Okay. In order to reopen, well, I'll call it reopen. It's sort of my reopening checklist, but this is your checklist for how to go out again safely. These are the guidelines you're going to follow as you start to expand your world. And some of you might even be going back to work or thinking about going back to work, but to start venturing out from the strict quarantine that we've all been really following. There are 4 things to follow, and they all have to be followed. 1 is hygiene, and I'll explain each one. 1 is hygiene, 2 is distancing, 3 is masks, and 4 is screening. Okay, so let's start with hygiene. So what does hygiene mean? Hygiene means cleaning your hands. And so you know this already, and you can wash your hands or use sanitizer. I know that somebody posted they can't find Purell. There are other hand sanitizers that are rapidly, you should be able to find some kind of hand sanitizer. If not, you can use wipes, antibacterial wipes to use. And so, you know, I was able to find hand sanitizer on the internet. So if I can find it, you should be able to find it also. And so some sort of hand sanitizer, but you're going to clean your hands or wash your hands every time you go in and out of any group setting. So anytime you're anywhere where somebody might have touched a surface, you're going to wash your hands. So like I'm doing it, I keep a vat of wipes as well as I just ordered, like I said, this hand sanitizer. I got a whole case of it in the office, and they're these little bottles. I got like 72. So I actually, if you email my office, we could probably sell you a bottle. But we got little bottles of hand sanitizer, and so you can keep it in your car. But certainly, as soon as you get home, you're going to wash your hands. And so anytime you're out in the public, if you're in a group, so like for people going back to work, you want to, you know, clean your hands. And so if you're home, if you're in the group setting and you stay in a group setting for an extended period of time, you actually want to go every few hours, like every 2 hours, wash your hands, like for no reason. You just wipe your hands or wash your hands. So it's constantly, you know, in doctor's offices and in hospitals, we used to do that every time we went in an exam room. You just would stick your hand in the Purell thing, do that, and you know, every time you go in and out of those rooms. So hygiene is about hand washing, and it's about disinfecting surfaces. And so I would say, just to be safe in your house, you should be wiping down surfaces. Certainly if you're someplace where you're in a group, you want to wipe down, like in my office, I would wipe down my desk in between seeing patients, but and such. But if it's just the rest of you and you're thinking about, you know, if you're home, common surfaces should get wiped down every day, just in case you bring something in, right? And so disinfecting daily. And that includes the bathrooms, right? So wiping down the bathrooms. So you want to be disinfecting and washing your hands. That's hygiene. Everybody has to be practicing good hygiene. And I think this we're already doing, right? So you're doing that already. But as you venture out, you're going to have to really be conscious of doing it more frequently when you come back in, you know, all of that. And so that's the hygiene piece. That's number 1. Number 2 is distancing. All right. So we all know about social distancing, and that's fine. And we all have been doing that. Well, at least I hope so. And the last thing we'll talk about is culture and what's maybe problematic for some of these things happening everywhere we go. But in terms of distancing, I think we've all got that in our brains, 6 feet. Do video meetings whenever possible. And I also told you to limit your exposure to 15 minutes. Quick, if you're going to go see someone or you have to talk to someone, don't stand and talk to someone without a mask for more than 15 minutes. You don't want to talk to really anyone without a mask, unless they're part of your social group and that you've been quarantining with. Okay, so the distancing. So you have to practice hygiene, you have to distance. We've all been doing that. Now we're adding masks to the equation, right? Now we've all decided, and there's finally an agreement, that everyone must wear a mask when gathered at work or in a group setting, if you find yourself going to the doctor's office, you know, and waiting in a waiting room, or you find yourself anywhere you're around other people, you're going to distance, you're going to wear a mask, and you're going to wash your hands as soon as you leave that setting, or even if you're there a long time during, right? Um, Interesting, what I've been reading about masks is the surgical masks seem to be really good. The surgical paper masks are the ones that are the blue ones. They actually have two linings. I just ordered a whole batch, so I just got them online. So the batches I got were on Walmart, right? I went to the Walmart website and I got a bag of 50. I got 200 for the office, but they come in packs of 50 surgical grade masks, and they have like a white, they're double lined, so it's blue on the outside and white on the inside. Those apparently they prevent 99% of virus particles from going in and out. They block the virus from the person breathing out. If it doesn't fit you really well, you might have some space, so maybe, you know, you're at a little risk of her coming in, but the thought is 99%, because those actually are, the way that they're built, they fit really well, right? They really stay closed on the sides. The cloth masks, which are also really good and fine, apparently those are more about 75% of what you breathe in, right? Because you can go, those have more gaps around so the more tightly it fits is the better. But cloth masks is still really fine, okay? That the estimates are about 75% gets screened out from the cloth. The N95s are not necessary. The problem with N95, and you don't want to do those unless you're in a healthcare setting where, you know, you have extraordinary amounts of virus particles that you're exposed to, because those are tightly fit around your face. None of us need to be wearing those. The surgical blue ones are fine. The biggest obstacle for masks is culture. And you can see that our president won't wear one. And there are places in our country where people are refusing to wear them. And there are big fights and partisan fights happening with this. This is a critical piece to preventing spread of the virus and to protecting yourself. So I'm here just saying, because our culture can't decide what to do unanimously, I'm here to tell you the 4 things you should do. So always wear a mask. Always insist that the people that you're going, wherever you're going, that they're all wearing a mask too, because the mask prevents you from getting it and from giving it. And so part of what we're doing here with the mask, it's really an altruistic thing. It's our role as a participant in society to be, to not give it to people, to not spread it, right? And so, which brings me to number 4, which is screening. So screening is the last piece that we have to take ownership of in order to make this work. So hygiene, distancing, and a mask, and then you have to screen yourself to see if you're sick. And then if you are, you have to quarantine. Workplaces have to screen people before they come in, okay? So there's a certain amount of self-screening and public screening if you're thinking about going back to work that we all have to do. And so here are the things you're going to screen for. And if any of these are positive, you don't go back to work, and you actually have to self-quarantine until they go away. You cannot go breathe on the public or to anybody. Fever, cough, sore throat, shortness of breath, loss of taste or smell, nasal congestion, runny nose, any of those. Now, we talk about screening your temperature. The problem is less than 50% of people actually have a fever. So fever is really turning out not to be the best screening for this virus. It's all of those symptoms. So if you've had a chronic cough, you have a sore throat, you have shortness of breath, you have a runny nose, and you think it could just be allergies, you know what? You should not be outside without a mask. You shouldn't go out in public. You should be very careful, and you should go get tested. And so if you have any of those symptoms, if you're in a situation where you can get a test, call your doctor and ask for a COVID test. And that's really what needs to happen. You need to go get a COVID test. If you can't get a test, then you need to self-quarantine. And the general rule of thumb is 7 days from the onset of symptoms. It seems people are the most transmissible for the first, the day your symptoms start, and then it really wanes after 5 days. Yes, they're testing people and they're finding some virus particles. That people still have some virus that they can detect in their saliva. Even after 1 week and 2 weeks, but we're really questioning how sick, how much you can actually make someone else sick from that low amount of viral load. You see what I'm saying? It's about the viral load, like how much virus you're spitting out and the amount of time somebody spends breathing it in, right? So it really is the day before you get sick and those first 5 days perhaps that you're the most contagious. And so the thought is that if you develop any symptoms, you really should consider yourself contagious for the first week and you should get a test anyway. And so we have to sort of quarantine people with symptoms, and we're counting on you to do that. And if each of us takes that responsibility, everyone has to self quarantine. And so this is the screening. It's screen yourself. And then employers like myself, I'm definitely going to be screening all my employees, and I'm going to be screening all of our patients who are going to come to the office. So anyone who wants to come get a blood draw, we're going to do a screening for you, and it'll be a phone call to go through this list of questions. And if it's all no, we'll check your temperature when you come in, and you'll wear a mask, and then you get to come in. And if we do all this, we're going to start having a sense of sort of self-efficacy and self-efficacy meaning, we we have some control over the situation. We have to all start feeling like we have some control. And I think that having that sense of control is going to really make a difference for how we emotionally sort of manage this thing, because I think we're going to be here for a long time. It's actually the way that I've read some really great people writing stuff, and one author calls this dancing with the virus. We're going to be dancing with the virus for a year or 18 months. But we shouldn't have to go back to the quarantine we just had unless there's a big flare, unless there's a big another wave that comes in the fall when the weather gets cold and we all go inside, which is possible, right? Especially in the Northeast or the North, or where the weather's cold. People who live in warmer climates that can be outside year round, I think those, other than if there's like a meatpacking plant, or in New Orleans, where there was the jazz festival or whatever it was, that everyone was closely packed. If you avoid those scenarios, and so where do you need to avoid? You need to avoid, concerts where everybody's screaming and yelling and singing, because that spews the virus. There's thoughts about, movie theaters can open sooner because we don't talk. We just sit down and we watch, and we're not spewing virus into the air. And so if you spread people out and you you social distance, and there's ways that this can work. Restaurants, if they're outside, the problem with restaurants, it's a closed container, so a lot of really smart people are trying to figure out how to make this work. And restaurants are tough because you have to take off your mask to eat. And so I really think personally, the first place I would venture forth in a restaurant would be an outdoor seating, somewhere outdoors where they have everybody spread apart 6 feet. Indoors will have to be really good ventilation, and hopefully they'll have that ready for the fall, in places that have to go indoors. But in warm weather states, they can move outdoors year round, in like Southern Florida, and so I think that might be one of the reasons Florida's done pretty well, is because they're a warm weather state. All right, so I'm going to open up the forum. I'm going to go to my questions now, because I know there's a lot. And this is the next piece. I'm sure there are questions about treatment and all that. I'll answer those as we go, but I wanted to focus on the next steps, because, who was it? It was one of the great generals of all times that says we have nothing to fear but fear itself. And I'm not throwing caution to the wind at all. I'm still here quarantined, but I'm going shopping now. And I went to the plant nursery yesterday, and I'm not afraid of the mail anymore. I'm not wiping it down. I mean, that's not how we're getting this thing, right? And so I'm less afraid of my newspaper and my mail. And I'm actually, not doing that much wiping down of the groceries either, although I'm still being very careful when I bring it into the house. But I think that we're really learning it's this, person to person. And if we do these 4 things, remember these 4 things, it's hygiene, distancing, masks, and screening. And we do that, And we do that wherever we go, and you avoid groups if you can. But if you're going to go do a group activity, that you want to make sure that whoever's running it are doing those 4 things, that everyone's wearing a mask, there's hand washing happening, hand cleaning happening, and everyone's social distanced. And if we do those things, I think that we can find a way to safely dance with the virus and resume living again in some way. All right. How soon after exposure can you be tested? I have to fly from Boston to London. Yeah. This is a good question, because I'm sure everyone has questions about this. This is a kind of common thing that's going to happen. Flying. And then what do you do? How do you quarantine, and what happens after you fly? So I have to fly from Boston to London. I will take precautions. However, if I might be exposed, when would testing after my travel make sense? So the COVID would show up 4 to 5 days. And so the average amount of time it takes to get sick after an exposure is 5 days, which means by 5 days, half of the people will already have shown symptoms, and some people, so 5 is sort of the average. I think that the majority of people are going to be symptomatic after a week, and probably, like I said, you'll hit that halfway point at 5 days. So I would say to wait a week unless you get symptomatic. I think that if you get a good dose of virus and you're going to get sick, you're going to get sick by the end of that first week. So I would wait 1 week and monitor yourself for symptoms. And I would stay home for that week, right? So after the exposure, there was a member of my team at Blum Center who flew last weekend. And so she's home this week. She's working from home. We all have to be responsible. It's a very altruistic thing, right? It's not just about protecting yourself from the outside world. If everyone adopts a culture of, I'm going to do these things to protect people from me, I'm going to do my part, then we'll all be okay, right? Cloth masks, seeing that not good protection. Cloths are still turning out to be pretty good, okay? They're going to definitely protect you. They'll protect you. 75% of virus won't get through there. But the surgical masks are just even better. So do cloth if that's what you've got. If you can get the surgical masks, that's even better. So that's how I would sort of put it that way. The virus dies after 3 hours on cloth, I read this morning. And so you don't even have to wash it. You can take your mask off and just stick it in a corner and just let it sit there. Or leave it in your car, or leave it, I just leave mine in my car, the cloth one. Because I go in my car so infrequently now, so by the time I'm going to go back in the car, it'll be fine. And so yeah, so a little difference in surgical mask effectiveness, but cloth is really doing the job as well. And so if all you have is cloth, don't panic, right? Don't worry. It's really going to help protect you from most of the incoming that you're going to get. What are the latest recommendations for supplements? Do you believe there are supplements that can fight off this virus? So I'm going to refer you to the blog. So remember last week I said that I'm going to update the blog. I went and updated the whole blog with the list I gave you last week. So I'm not going to go over that this week. You go to blumhealthmd.com. Okay, blumhealthmd.com. Click on the blog. And actually, if you go to blumcenterforhealth.com, any of my 2 websites, there's a blog at the top at the header. You can see blog. You click on it, you'll go to the blog. So my blog post is up. It lists all the supplements. It's the latest and greatest of what we know. What I want to remind all of you about supplements is the list is based on studies. The dosing on the list for each supplement is based on studies that were done using only that supplement. Right. And so, for example, like what's on that list? Something like quercetin. So quercetin is on that list, right? But quercetin, the studies that were done on quercetin use like 2,000 milligrams a day, which is 1,000 milligrams twice a day. If you're taking 7 or 8 of the things on the list, of which some of them are in your multi, so you're already taking them, you do not need to take that dose of quercetin, nor do I recommend it. You don't need the full dose of everything. There's synergy between things. And so you'll see that there are different blends, and, so some of the blends that I'm using have 250 of quercetin in it, or 250 to 500. Like if that's one of the many things on the list you're taking, you do not need that full dose. And I actually should probably go in and write that on the blog and update it which I probably will do at some point. But for now, all of you keep that in mind. Okay. Please do make sure that I'm on your mailing list, as your updates have been very helpful. So Julie, if you can please, if you're you're already on this list, so you will get on the list. All of you here registered, so we will definitely, I'll let you, you will get a reminder next time I'm going to do this. But make sure, so here's the other thing. I'm planning on going back to Instagram, so, and doing more Instagram. So I'm so bad with that, because I don't know. I have to get myself more like doing Instagram. Okay. I find this easier in some way, just to talk into my computer, or to talk to all of you this way. But so I would say for the person, the other thing is, everyone's just sending the questions to me. A reminder to do all attendees. It says panelists and attendees. There's a little drop down arrow. So make sure you're sending your question into everyone so they could see. But this person said, please make sure I'm on your mailing list. And so you're on this mailing list, but I would suggest that you sign up for our newsletter, but you probably are already if you're on this list, and follow me on Instagram, because that's where I'm going to focus my efforts in the next few weeks, to try to expand the reach of my conversations. Do you think colleges will open in the fall? Do you think they should open, given how much less that age group is affected? So there's a very hodgepodge response, as you all know, to the virus. And I think different colleges are going to do differently, depending on what state they're in. Some states are more aggressive with opening everything up than other states. And so I think some colleges are going to open and some won't. We're already seeing that. Some have announced they're not opening and some have announced they are. It might be possible for very small liberal arts, small schools to open. I'm not sure. I think I think they're really trying to open. I would like to see colleges open. I mean, it's just hard to imagine the kids. So the four things I just talked about, right? So wearing a mask, social distancing, hygiene, and screening, right? There are apps now. I have to figure out the app, but one of the articles I was reading this morning has, it's the author works at a hospital, and there's an app that every morning, in order for him to be allowed into the hospital, he has to log in, check off if he has any of those symptoms, and if he has any fever, and then he also, his temperature's checked, and if he gets a green pass, he's allowed in the hospital. And so I really think if we do all those four things, in a college that's not too big, right? The huge universities that have 25,000 kids, they're going to have a tough time doing that. But the small schools that have 2,000 kids, or the small and medium colleges, they might be able to find a way to, because when I talk about screening, this term I use for screening, that's really the same thing we're talking about sort of surveillance, right? And the ability to find a case and quarantine them. And if you can have good surveillance where you can find people who are sick and quarantine only them before they can spread it to everybody, then everyone can go out and about. So if a college can adopt the four things that I just said, they really have to take on sort of what the hospitals are doing. What I went through with you is the classic, what this one hospital's doing that this doctor wrote about, this article I read this morning, right, is an active app for surveillance. So there has to be some way to surveillance. So I think some colleges will be able to rise to that moment, and they have the resources and the ability to put together this 4-step program. You have to do all 4 steps. You can't just send people out with masks and tell them to wash their hands and stay 6 feet apart. There has to be active screening. And so if they can do that, then I think they'll be good. But I don't have an answer for you about what's actually going to happen with them. What nursery do I utilize? I went to Perennial Gardens up in Bedford. I'm in northern Westchester. So I went up there. They were so on it. Okay, you don't check out the same way. There's like arrows, check out here, and the whole checkout process is like outside. And I mean, it was great. I felt completely safe, and I'm not really worried about like going up and asking someone a question and standing, they're wearing masks, I'm wearing a mask, we're all outside. Hey, do you know where those angel wing begonias are? Can you help me find them? Sure, they're up over here. Oh, where are the impatiens? Oh, they're over here. We have to stop being afraid of each other. I was masked, they were masked, we were outside, we stood 6 feet apart. We did not spend 15 minutes in each other's faces. And so we're going to be okay, right? We can do that. Have the immunity tests gotten more accurate? Do we know yet if we are positive for immunity? Does it indicate? Okay, so it's the immunity question. It's such a bummer, right? This whole immunity question, because the tests are just not great. I mean, they're okay, but I have a patient who we now finally got a positive test back, but who we really believed she had it. It was all the right symptoms. Her COVID test was negative. This was back in March. Her COVID test was negative back in March. Her first antibody test, like a month later, was negative at LabCorp. And we finally just redid the antibody test, and this time it had an IgM. LabCorp now has IgM, and her IgM came back positive. But with a very high suspicion, it did not make any sense that she was negative all this time. And so what we're doing now is people who have the list of symptoms, and it's not just having those symptoms. I mean, it dragged on for a while, weeks of feeling that way, So for people who, you really have a strong likelihood of being positive, you really want to assume it's positive, okay? The antibody tests, I think, are getting better and better. Quests seem to be Quest is FDA emergency approved, but now it turns out that some of the ones that are FDA emergency approved aren't even that great. Look at the false negative rate. Wait, 1 second. Look at the false negative rate in the White House. They're saying that's the rapid test for COVID. That's not a good test. The one that's 15 minutes to get the results, we now know that's just not a great test. And so, wait 1 second. All right, that's got to be a little bit better. Oh yeah, that light was just way too bright. And so we know that that's generally a better test. And so we know that's the COVID test. In terms of antibody testing, I think it's going to get better and better. And so I just keep repeating the tests on people if we really think they should be positive. But there are a couple of companies that are getting better. So I do like Quest, and I am using LabCorp. And it's possible that it took time for those antibodies to turn positive. Okay, so yeah, the tests, we have to improve our tests, and a great country like America that we don't have good tests is just, don't get me started. Okay, so let's say you do a test and you are positive, and you're positive, and you had the virus, and so it's likely we can believe that you really are positive, right? You had some illness and you're positive. So does that mean you're immune? And I would say that we can assume that you definitely are going to be immune. Whether or not, there's no evidence anybody's getting reinfected. So I think that you can feel good about that. Like, just feel great about that. And then as the weeks go, we're going to know more and more about how great you can feel. The issue is that because we don't know for sure how much protection you have. And until we have antibody tests, so the next level antibody tests that are coming are going to tell us quantitatively how much antibody you have, right? So rather than just yes or no, it's going to be the amount of antibody you have. And it really looks like people are making good, robust antibodies to this virus, especially if you were sick. And even people who were mild illness made good antibodies as well as the asymptomatic people are making antibodies. We're finding them, but we don't know how high the levels are, right? Because we don't have quantitative testing. So I would say until you're not going to be able to relax your guard. You're still going to have to treat yourself, but in your mind, you cannot worry so much. Okay. Like, in your mind, you'll know you're good, you're likely good. We just don't know how good. So until we can get quantitative antibody testing where we can tell you the level of your antibodies, um, and make sure they're staying high over a period of time, I would say to behave when you go out in the public just like anybody else. And you're going to wear a mask and you're going to social distance, because everyone else will be afraid of you if you walk around without a mask anyway, because they'll think you're violating the culture, right? So you're going to do everything the same. But in your heart of hearts, you should just know that you really are going to be immune in some way, and it's going to be great. And we're going to be able to give you guidelines about that very soon. Okay. I don't use any social media, so I will lose the opportunity to get the valuable information you provide. Oh, Claudia, that's really nice. I'm going to come back, okay? But I'm just not going to do it every Friday. So I'm probably going to just drop it back to like every 2 weeks or 3 weeks or so. Yeah. And so I'm also posting up blogs, and look, you might want to just open an Instagram account. I don't know. But I'm sorry. I'm glad you've really appreciated this, and I will come on. It's just not going to be something I'm going to sort of promise to do every week. But you're on this list. You're on the email list, so you will be notified when I'm going to do the next one. Okay. Have the immunity to, oh wait, we did that one. Oh, somebody else asked that. But if you're positive for immunity, I really think you can rest assured you're not going to get the virus again. That's really what the indications show. But you're still going to go out and you're going to protect yourself and pretend when you're out that you can. Okay. But you don't have to be as nervous as everyone else. I have felt like I was getting sick 3 times since the pandemic started and took high doses of vitamin C, echinacea, mushroom blend, my community mushroom formula by Host Defense. That's a good one. Fish oil and ginger. I did not get sick. I can't help but wonder if it was corona and I was fighting off. What do you think of the chances it was corona? I know it requires testing to be sure. There's no way of knowing. I would say that if you really only felt mild symptoms and you didn't get really sick, it probably was not corona. Most people get sick and they know it. There's a lot of wishful thinking of, oh, I had this mild thing. Maybe that was it. Oh, I wish that was it. Most people are testing negative, in my experience, of the people that I know that are like, that had a little mild something, it was a little bit of a sore throat, maybe that was it. Everyone I know that's tested positive, they knew they had it. It was painful. It lasted a week or 2 or 3. It took a while before they felt better. It was the worst headache they've ever had. It was the worst body pains they've ever had. It was, they knew it. So I would say it's unlikely, but it's not, definitely not. So you need a test. That's all. Do you think it's safe to exercise outside with a group of 10 if you're all 6 feet apart? That group's a little bigger than I might like. I think we're talking about groups of 8, and you might want to spread more than 6 feet apart. But it's an interesting idea. It depends on how much aerobics. So this brings you to the discussion of how far does because you're not going to be wearing masks when you exercise. So that's a little bit of a high risk kind of thing, right? Because it turns out you project the virus differently depending on what the activity is. So it turns out singing is actually a very high risk activity. It's like coughing and sneezing, because when you sing, you reach into the deepest parts of your lungs and you expel the air. So if you're working out, you've got like, if you're doing aerobics and you're working out and you're deep breathing, you're really breathing and exhaling from the deepest part of your lungs, you're going to breathe out a lot of virus. It's going to go further than 6 feet. And so there are some studies that show people who cough under certain conditions, especially inside more than outside, it can go as far as like 20 feet, and it goes really far. And of course, it's only in those first few days when somebody's sickest. There's a 5-day window when there's a lot of virus. But I wouldn't do an exercise class 6 feet apart from people, because the breathing is just so deep. And so it's 6 feet is the rule when you just have normal levels of talking and not too much, just when you're just speaking. Anything like singing or exercising or coughing or sneezing requires further apart. What about all the new exposures in Texas after reopening? I know. Well, that concerns me. I don't know if you're talking about the bars and everything. Sure. Well, that's no good. I wouldn't go to the bar. Are you going to the bar after what I just told you? And they were showing pictures of people without masks on. So 100% not going anywhere without the four things, right? If you're going to walk into a public space or in a room or in a group setting, you need to make sure all four things are happening in order for it to be safe. Remember, social distancing, hygiene, masks, and screening. And so and they've opened in Texas, everything. And so you can go get, like I was thinking, oh my God, like when can I get my hair cut kind of thing, right? So it's a one-on-one situation. You could say, let's not talk, because talking exchange, you can just try to keep quiet and just breathe in your masks. And they're not in your face, they're sort of behind you. And yeah, you spend a little time together. It's more than 15 minutes, but there's not a whole group of people. And you can ask them all the screening. They can ask you and you can ask them, have you had a cough or sniffles or anything? Like you can screen it and you can wash your hands. And so there's ways to mitigate possible exposure if everyone's got masks on. But Texas, I don't see them meeting those four criteria. Do you? Right? My four things, remember? That's what makes it safe. If everybody follows that, airplanes, safe flying on planes. Planes are full with passengers that do not want to wear masks. Many stories about COVID being. I'd be very nervous. I'm nervous unless the airline makes everybody wear a mask and keep it on. I'd be very nervous. And until the airlines do something about their oxygen, the flow of air, because there have been some illustrations of like somebody breathing and showing how their air like goes in circles around all the people right around them. And so I would need to see those four things in place for an airline for me to be comfortable. I would need them to do temperature screenings, even though it's only going to be 50%, but they would have to say we're not allowing people on board if they temperature screen, because people can lie. And this is where culture comes in. Unfortunately, you can't trust everybody. We have a lot of people in our culture who just are ignoring the rules. And that makes it sort of sucky for the rest of us. And so I don't know how the airlines, they can make everyone wear a mask. They can't make them keep them on, unfortunately. They can just drop the mask and let their nose, people, if you see people that have the mask with the nose out, that's not going to protect you, because there's virus in the nose. It's better, the mouth is covered, but that's not perfect, right? And so there's a certain amount of trust in the rest of the public, that they're going to do the right thing. And so the airlines need to meet the four things. And so, my guess is you could meet sort of masks, hygiene, and the social distancing is not being met on some of those airlines. And so you don't have the social distancing, and part of that is the air exchange, right? We'll put air exchange into the social distancing bucket, because by social distancing, you're ensuring you have good airflow that's untainted. And so being in a closed container with poor airflow and no social distancing, there goes one of your four things. And so you can't meet that. And they're not doing adequate screening. If they start doing some temperature, that meets like part of the screening, but really it's a questionnaire. Everybody has to answer those questions. And if they have any of those, they shouldn't fly. And if you meet any of those, you shouldn't fly. But unfortunately, people will lie. And so it's a big problem. My mother's in Florida. She always comes up for the summer. And I don't know how she's getting up here, but the airline isn't going to work. So she might have to, and she can't afford to put her on a private plane. Thank you very much. And so I don't know. I think she might have to, I don't know what we'll do. We might have to get like a couple to drive her, like to drive in the car. But then I worry that she'll come up here and then she'll get stuck up here for the surge in the fall. It's one thing for her to stay with me July and August. It's another thing for her to live with me through like indefinitely if this thing doesn't go away and she can't get back to Florida. So, and she's doing fine down there. So, but the plane is a big problem, I hate to say. Are you selling masks? Do you have one that you recommend? I'm not selling them, but I got mine at Walmart online. Okay, they were surgical masks. I got there. It was like $49 for about 50. You know, I got 200, but sorry, I'm not selling them. I need those for all of my people. Will option to become a patient via telemedicine service expire at some point? So, or is this a new permanent option? Well, Margaret, this is an option forever, I hope. I really hope so, because I don't anticipate us putting that genie back in the bottle. I think telemedicine is going to be here to stay, and I'm really happy about that. And so, yeah, so it's here to stay. And we're trying to figure out a way to make everything more economically easier on everyone. You know, the problem is I have a lot of salary. You know, listen, my own struggles at Blum Center, I don't need to bore you with, but you know, my business is in trouble. You know, most people at all doctors' offices, business is down. So please, if you were thinking of coming to see us as a new patient, come now. I have 2 other clinicians and a health coach and a nutritionist, and everybody's 50% busy, you know, and we have a great team that takes good care and provides excellent service. So I have front desk people and I have medical assistants. And so far I haven't had to lay anyone off because I got money from the paycheck program. But unless things start picking up, you know, we're looking at laying some people off. So, so I'm trying to figure out how to help everyone overcome their fear of like living life again. You know, it's not just me, it's all of my medical colleagues. Everybody's offices are empty. And thankfully we've been doing telemedicine all along. So, for follow-ups, it was just new patients that we now can do. So I think we're going to do that forever. And we're trying to find ways to lower the barriers so that you can come see us. We have so much to offer, because here's the thing, as you all know, because you've been following me, all of you here. Functional medicine is how to build resiliency. How are we going to dance with this virus for the next 18 months? Not everyone is even going to want a vaccine, right? So how are you going to make sure that my hope is that the treatments become really effective so we don't have to worry about the death rate being, you know, 10 times more than influenza, which it looks like the death rate, although we don't really know because we don't know how many people are sick out there. So I sort of take it back, but it seems that the mortality rate is a little higher than influenza. And so how are we going to reduce the mortality rate? How are we going to get effective treatments? And I'm hoping that that's what really breaks us, not to worry so much if you get it. Okay, so I'm going to get it. I can take an antiviral, it'll shorten the duration. I won't get as sick as the current crop of people get. But anyway, telemedicine is here to stay, I believe, for a long time. So yes, we're not stopping that as long as we're allowed to from the Medicare, and my malpractice will pay for it. And so right now it just follows what Medicare says we can do. Will option to become, yeah, I can't find Purell. I know. You go online to figure out what else you can use for hand sanitizer. There's a lot of conversation about that on the internet. So I'm not gonna provide that for you. Governor Cuomo just extended the stay-at-home order until June 13th. Yeah. So I didn't know that. I was watching that yesterday. I did see the different areas of New York. And so we're in this, we've only met, he has 7 criteria for opening up. And there's, I guess, out of the 7, there's only 5 of the counties in New York that have, or the sections, he broke New York into different sections. And I think it was 5 have met all 7. Westchester, where I am, have met 5. Yeah, I mean, I'm an essential service. So for me, my trying to figure out how to open up is that, you know, I'm going through all of these things, but even, yes, we're all staying at home. And even with the stay-at-home order through June 13th, which just means businesses in Westchester then aren't going to open, which is unfortunate. But all of you that are listening, you're going to start venturing out to go to a doctor's visit. If you have to go to the primary care, if you want to go get blood drawn, if you want to start like taking that little toe in the water to start doing a few more things, going hiking. I've been going to Rockefeller Oops, I didn't say that. Nobody else go to Rockefeller. I don't want it to get too crowded, but it's pretty crowded already. But it's actually, there are a lot of people out on the hiking trails. It's okay. Wear your mask. There are places people aren't wearing masks, and that's upsetting to me. But I know the trail, so I head to the back part of Rockefeller so that there's nobody's there. And if there's nobody on the trail, I take my mask off. I go with my friend. I have a quarantine friend who we've been hiking together from the beginning, and I meet her to go for a walk. Meet your friends and go for a walk. As long as you know they're safe, and if they're not, then don't walk close to them when you're outside walking, but outside's good. But these are the kinds of things that we can start doing even with his stay-at-home order. A couple of things, like I went to the store, I went to get plants, I think, but businesses just can't open up until then. But we can start doing more things outside and get ready for how we're going to do these things. But Cuomo's really doing the right thing for all of us. By the time we open, our cases are going to be so low. He wants to make sure that our hospitals are ready for a surge if that happens. Do these new openings and going out pertain to autoimmune patients with lung involvement? Yeah. And so the going out. So who's ready to go out? So that's I guess the additional piece is, when do you know if you're a person ready to go out? And I would say that, that you're going to, if you're a high risk person, especially if you have any pulmonary disease or lung involvement in your health condition, then you're a high risk person. Autoimmune all by itself, unless you're on immune suppressing medicine, doesn't put you into one of those categories like hypertension and cardiovascular disease. So you're not on that really bad list. But if you have any health concerns or any reasons why you're a high risk person that you've been really super duper quarantining, you do not want to go into any of those group situations. When I was just talking about what's next and how we're going to start venturing out and be around other people, you will be more restrictive than that. So you need to really stay at home and not do those things and let someone else go shopping for you for now. So the high risk folks, you continue to let other people go shopping and go out. But I do think if you're a high risk person, you can go try to spend as much time outside as you can, go for a walk. And certainly when wherever you live, if you feel safe, like here in New York, when we finally lift the quarantine, I do think you will be able to expand a little bit, but only you're going to be more restrictive than everyone else. Yeah. And if you're not sure what to do, especially since you're a patient of ours, schedule a 30-minute call with your practitioner just to go over where you're at, what's happening with your immune system, and to really sort of get personalized guidance. The good news is you're a patient, so you can get individualized guidance. And this is one of the things sort of to point out to all of you. And that's why I made that, we have an immune consult. It's 45 minutes. You can just schedule a short visit and for new people, if you don't want to become a new patient and do the whole big new patient thing, you can come in for a 45-minute immune consult and just talk about that. What do I do? Because everybody's different. Is it really newsworthy that the virus can enter through the eyes? Some newspapers are saying how you can contract COVID through your eyes, but it's a mucous membrane, and we already knew that that's where the virus sticks. Right. Not newsworthy to me, and obviously not newsworthy to you. So I think part of but they're just confirming that. So yeah, the eyes are mucous membranes, and that's a problem. If we get sick from COVID, where can I find a hospital in the Westchester, Connecticut area that gives vitamin C for COVID? Good question. I actually don't know. I don't know who's giving vitamin C. So if you get sick from COVID and you're home and you want to be home as long as you can, you're going to give yourself vitamin C, right? And so you're going to take as much vitamin C as you can tolerate, 3 to 6 grams a day. There's powders that you can do. It gives you diarrhea and some stomach upset. And so you might have to try different formulations to not get the stomach upset. My favorite one that is low on stomach upset is PERQ, but PERQUE, but like everybody's out of that one. But then there's really good buffered ones. I think we're using the orthomolecular one, powdered, and we're using Designs for Health has a powdered one. And so, you know, where you just do like a teaspoon every 2 hours, you know, or something, but you just could dose yourself up on vitamin C. And there's actually pretty good, I wouldn't call them studies because they're not official studies, but I've read a lot. I've read where they've been giving people even oral vitamin C seems to help. So you can do that yourself, but I don't know where it's happening in Westchester yet. Glass Onion in Pleasantville has hand sanitizer and other supplies. They have a website. Excellent. Thank you, Deborah. That's awesome. The Girl with the Louding Voice is a great book. Any other recommendations? Didn't we do that last week? I think we did that last week. If anyone wants to put up books again for Alice, we can do that. I actually wrote them down somewhere. I don't know where they are right now. How do I use hydrogen peroxide in nebulizer for COVID lung issues? I don't know. I read about that, and I heard that there are some integrative doctors doing that, but I've never prescribed it, so I can't really, I don't know. I'm sorry. And I've never used that before, and I haven't really read, I sort of read about it and sort of case studies of people like posting, like clinicians posting that they're using this and they're getting great results. You know, without something a little more than that, I don't know, I don't know that I'm going to prescribe it without a little bit more help and evidence that. So my daughter and her boyfriend are coming to visit me for the weekend. He has gone into his office in a limited way with a few employees. How do I manage my interaction with them? I don't know how old you are, Monique, in terms of if you're a really high risk person. If you're under 60, then fine. If you're over 60 or 65, you might not want your daughter and her boyfriend to visit you. Technically speaking, they shouldn't because he's getting outside exposure. What you can do is you can find out, you know, well, if you're going to decide you're going to do it, even though that's not really a pure kind of interactive group, right? Because you're interfacing with all of the people he works with and all the people that they interface with. And so, like, I know in my office, for example, I have 4 people working in the office every day, and I know exactly, they're all quarantined in their own homes. So all my 4 people in my office are totally safe. So if anyone in my office went to visit their mother, I wouldn't worry about them. So you have to inquire a little bit more. You have to know more about exactly what's happening in his office. How close does he sit with them? How much interaction does he have? You know, what are the rules they're following in his office? Are they following the rules, you know, of social distancing, washing hands, wiping surfaces, right? And so if you do all that investigation and you feel he's a low risk individual, I would just social distance from him 6 feet and spend as much time hanging out outside as you can. And if you're at a table, when you're eating meals, you should sit 6 feet away from him. Sit at a separate table or sit 6 feet apart. I mean, you should be following all the group guidelines that I gave you with the 4 things. With him, because he's an unknown entity, and your daughter's with him, and so she's exposed to him, so they sort of both are. So no hugging, no nothing. You're going to have to do the whole social distancing thing with them, and stay at least 6 feet away and eat 6 feet away and wash hands. I would wash hands like every 2 hours. Keep washing your hands and washing, and have them wash their hands and wash their hands and wash their hands, and no face-to-face unmasked time. Cloth mask breathing out percentage, I don't know. I just got the 75% was the number that I got. Is it safe for an acupuncturist to go back to practice now? You know, whether it's safe or not, the question is, will anyone come? You know, will people come and want you to do this? I think that you have to put in place, like what I'm talking about doing for my office is, here's your safe practices guidelines you're going to follow, and you need to start thinking it through. What are your safe guidelines going to be? You know, you want to, you know, wash or Purell your hands like right before you're going to wear a mask. They're going to wear a mask. You're going to Purell your hands right before in front of them. As soon as you go in to greet them, you're going to say, okay, I'm doing my hands, and you have them do their hands, right? And right in front of each other. And, you know, and you're going to have to wipe down everything in between sessions. You're going to have to, yeah, you have to really think through your process. And is there a safe way? And you're going to have to screen everyone. So you're going to have to ask them all if they have symptoms. Like the day before, you call everybody and you confirm the appointment, and you take them through the screening questionnaire, and you take their temperature when they come in. So you have to screen everybody. So you have to do the 4 things in order to make it safe for the environment. And so that's up to you. And my guess is you're not, and I would space people out so you have time to wipe down in between. And you have to communicate to people what you're doing to keep them safe. So you'll have to tell them, here's my office procedure. Here's what I'm going to do to make it safe for you. Anyone interested in coming in, let me know. And my guess is not that many people want to come. And I'm sure your practice has been devastated because it's a very touchy-feely practice. We have to find a way to come back. Otherwise, we're all not going to, our businesses, the economy, and our livelihoods are all going to not survive it. So we have to find a way to do it. And so, yeah, I think you should start your a medical, business so you can open. And I think I'm looking at June 1st. And I think if you start putting together a way to do it safely, we all have to find a way to dance with the virus. But it has to be really thoughtful and really strict. And you need to communicate what you're doing to people so that they feel that it's safe, and like what you're doing to make sure they're safe. And get yourself set up and do like 2 people in one day. You're not going to get a lot of people at the beginning until the comfort level gets better. I know, but we have to find a way to venture back out, whether it's June 1st or June 15th. It's coming for us in New York, right? It's going to be very soon. In the next few weeks, things are going to start lifting depending on where you live. Do you think a 9-year-old boy could wear a surgical mask? I ordered cloth mask for my son. Of course he can wear a surgical mask. He can wear cloth. He can wear surgical. Same thing. I mean, there's no reason he can wear the surgical mask is just that blue mask. So he can wear the same thing. What about a family gathering with little kids running around? I don't think anyone is putting masks on their young children. That's a really good point. I think a family gathering with little kids running around is outside. You can't bring people in the house. So there has to be an understanding that everybody stays outside and nobody goes inside. And the kids will run around, and, you'll all stay social distance as best as you can. So if they're kids and families you haven't seen in a while, you just have to have rules about staying, how you're going to stay far, you're not going to hug them, what you're going to do and what you're not going to do. If this is a family, if this is a group that's going to start meeting regularly and you want to expand the quarantine into a bigger group, then at some point you'll be able to not have those rules. But right now you're going to need to follow those rules. In terms of family gathering with little kids, I would still keep it small, right? And so my sister, for example, she hasn't seen her grandkids. So my niece and her husband and their 3 kids have been quarantined at their house. They've been strict, and my sister's been strict. They're all coming to visit Memorial Day weekend. And my niece is going to stay with my sister for a week. They don't need to quarantine when they get there. They don't need to wear masks because she's been quarantined in her house. She's been quarantined, and they're going to now combine their quarantine. And we know what everybody's doing. You have to have a circle of trust. You have to know what everybody's been doing. If any of the family members who are coming over, are being exposed, one of the parents is, a healthcare worker and goes back and forth. If everyone's been observing really good practices up till now, and you want to have a small family gathering, and we're talking like 8 people, right? You don't want to have, I've been thinking about that too. My niece and nephew graduated, one high school, one college. I'm thinking it'll be 4. It's the 2 parents and the 2 kids. I'm like, you know what? Maybe in a few weeks after June, I'm waiting till after June 1st, we'll have them over. And we'll have dinner. We'll do the backyard. We'll all just hang out in the backyard. They've been totally good. We've been totally good. And I don't think we're going to need to, I'm not wearing masks. We're just going to stay safely 6 feet apart. But I know where they've been and I trust them. And so it comes in, it's a level of trust. And there has to be a screening, right? Anyone sick? Anyone have sniffles? Anyone has anything? Great. We're still going to stay 6 feet apart, and we're still going to wash our hands a lot, and we're going to be outside. But there's a way to start doing it safely. So even if you're going to do little kids, you should not be having a family reunion of 30 people and 8 kids running around. Okay, that's not safe. So start small. I heard that masks and gloves lower your immune system. That's not true. I'm not even going to get into any reason explaining you why. Not true. Wear your mask. That's probably a conspiracy theory from China or Russia. Those are those bots trying to sow like fear, and they've done a great job. Our country is a total mess, and I will bet there's been all disinformation campaign. That's a disinformation campaign. What about taking your temperature? They do that if you go into a health center. It is, and it's not. 50% of people don't have a fever that have COVID. So it's definitely good, but 50% do. So it'll screen out half of the people. That's why you have to ask the questionnaires to yourself and to others, right? Screening questions if they have any symptoms whatsoever. What if you wake up congested and drippy as a rule most or all mornings? I guess if you notice a real difference in that, perhaps you should be tested. What are your thoughts? If you have chronic sinus issues that you've always had your whole life, or you have chronic allergies and you've had that all spring because you always have that in the spring and it's been going on for 2 months, then I would say it does not count as a symptom on the checklist. We're talking about recent or new cold symptoms, something that's a new cold that involves sinus and a congestion, okay? Yeah. We talked about quarantining people with symptoms, but what do we do about the people without symptoms? How will they know if they should get tested? And if someone works, you won't know, right? That's why you have to ask them. That's why everyone has to wear a mask, and you have to do all those other things. How will they know if they should get tested? They won't know. And if someone works in your office and tests negative and goes to work, how do you know they won't test positive the next day? Do you test them daily? No. But here's the thing. Everyone in my office, they're not leaving their house, right? They go home and they come to the office, and they go home and they come to the office. So we're all self-quarantined. There's no way and there's no reason anyone should become positive because they're not being exposed. If anyone does something, like I had someone go and fly last weekend, I won't let her come to the office until we've reached at least a week to see whether or not she develops any symptoms. Okay. And so at that point, yes, I mean, this particular person actually had COVID 2 months ago, and she's antibody positive, so I'm not testing her. But yes, so somebody who breaks the quarantine that we know went out and had an exposure, I would test them. It's a good idea. You can test them, before they come back into the office. But that certainly is an idea. But for now, the testing, if we had quick and easy and accurate COVID testing, you could test more often, but we don't. So the asymptomatic people you're not going to catch, but if you know where everybody is and you have everyone and you do the screening questions, and the asymptomatic people that have COVID are very low. I mean, it's like 20% maybe. We don't even know. We haven't done enough testing. Everybody thinks there's all these asymptomatic people. But I'm wondering whether some of those people are not false positives because a lot of the testing picked up other coronaviruses. And so we don't really know. And I don't think there's going to be that many asymptomatic people, to tell you the truth, because everyone I know that's been COVID positive, they knew they had it. They had something. This isn't, and maybe in kids it's asymptomatic. I don't know. I really don't think we know that yet. So in terms of my staff, I'm not worried about anyone becoming an asymptomatic transmitter of illness. But they're in the office and they are not wearing masks when they're with each other, but they're social distanced. No one's we're in 4 people in 4 different parts of the office. And when anybody starts coming in, no one's going to be in the waiting room. Everyone's going to stay in their car until we text them. You come in, you go right to the back. Everyone's going to be masked. We're going to be wiping down surfaces. So, so I'm not. Yeah. So you have to, in a workplace, you have to screen everyone and know where they are. We can't all stay home forever because we're worried about asymptomatic people. I don't think that they're the super spreaders. It's really the people who the next day develop a lot of symptoms and they didn't know it until the next day. And so because you have a lot of history with everyone, you'll know who those people are. All right. Is it safe to go to Quest for lab work? Yes, I'm sending everybody to the lab. They let you stay in the car until it's your turn, and then you just go in. You walk straight in, you've got your mask on, they're all masked, they've wiped everything down, you draw your blood, and you're gone 5 minutes later. Okay, so Quest is good. And Quest has a really good antibody test. So anybody who's my patient or a patient of Blum Center, you're going to Quest anyway, or you want to go to Quest or LabCorp and get an antibody test, let us know. We'll add it to your order, no problem. I'm still super nervous about takeout. Like, what if the chef coughs or sneezes on it before closing the container? I've been doing takeout, and I have gotten over that. We can all be very nervous about it. I open the containers and put all the food very carefully, and I put all the food on plates, and then I throw the containers away and I wash my hands. So while we don't eat out of the containers from takeout, we move everything right away out of the bags and out of the containers, wash our hands really good, and then we eat the food. There is absolutely no sign that this is transmitted by food, and that if people were getting it from takeout food, we wouldn't see the numbers going down in New York. Social distancing is working, staying home is working, and everybody's getting takeout. So, and believe me, all those healthcare workers in the hospital are all getting takeout, and all the people in the hotspots are getting takeout. And so we wouldn't see the numbers going down. The good thing about restaurants is they're all masked up, and they know how to do they've had to worry about making sure they don't get people sick. That's in their culture, is how to hygienically and sanitation, using proper sanitary processes, prepare the food. And so if there's an outbreak that gets traced back to them, they're sunk. So I think we can support our restaurants and do takeout. Do you think it's safer to buy your own groceries instead of using Instacart or Personal Shopper? I think it's probably I think both are safe. I think if you can do delivery, you should do delivery. It's less people that are going to the grocery store, and so Instacart is good. I've been using Instacart like every week for the past 6 weeks or a month or something, since one of you told me about it. The problem with Instacart is that last week, for the first time, I got like 6 things were wrong. Up until now, it's been very good. The shoppers that I've had picking out my food have been really good. This person, not so much. And so they made a lot of really stupid mistakes. Like, I wanted chocolate chips, for cooking, and I got Chips Ahoy chocolate chip cookies. I mean, that's really, I mean, there's not even close. So I wanted applesauce. I got cinnamon applesauce. Yeah. So I decided I'm going shopping. Green's Market up here in Mount Kisco is awesome. There's never anyone there. I go 8 o'clock in the morning on a weekday, and it's like empty, in and out. Everybody's masked. Everyone's staying away from each other. They have plexiglass up. Really not worried about it. I'm really careful. I wash my hands. Before I get in my car. I mean, you get used to it. It's a new normal. I don't think we should be afraid of going shopping. Just like I wasn't afraid. I was excited yesterday morning. I went and bought flowers. So we can go, but you have to do all these things. Okay. Opening windows in a space or meeting outside like a garden, wouldn't this be better? So not in contained air? Absolutely. Opening windows in a space or meeting outside like in a garden. Yeah. So anytime you can meet outside, open all the windows. Air and proper ventilation is the next whole piece to being inside, for sure. Put on your jackets and open all the windows if the weather's cool. Otherwise, open the windows for sure, and for sure meet outside. I don't know how to do that in my office. I don't know. I can have June come out, and my medical assistant, you can sit in your car and she could draw your blood from your car, or we could bring chairs outside, and actually maybe we'll set up the phlebotomy on the table outside. That's not a bad idea. We can do it all outside. I like that idea, but yes, adjusting to being outside. This is excellent news, but for those of us with suppressed immune systems and have jobs where we sit very closely to our clients for extended periods of time, usually in a small contained space, will we be able to venture out as you described? No, not you. So you're going to have to figure out, if you're a high risk with a suppressed immune system, you're not going to start seeing people in a closed space like that. You, at some point, as the prevalency, as the curve goes down and there's less and less cases, the next step, what's going to happen from a public health perspective is that the number of new cases is going to drop so low, and the testing capacity is going to go up probably by the end of the summer, by the fall, let's say, especially in New York, where Cuomo sort of gets this, right? That's why he's making us stay home till June. He wants to get us really, really low, our numbers, and then be ready. He wants to wait till the public health tracking and tracing and testing is ready so that any new case can be caught. And those people get tracked in their contacts and they stay home so that we don't have to. Once we have a sense that the population at large has very little virus traveling through the environment, then you'll have a lot more, you'll feel a lot more confident being able to be out in the public, even if you're a high risk person. But I don't think you're going to be able to go out for a while until you see the public health efforts to ensure that new cases are caught and tracked for you to feel safe. Seeing random public people, in a closed space one-to-one, that's going to be the last thing, and that's not happening now. But maybe you'll be able to find a way to do it outside, or to just continue doing telehealth the way you are. But you're going to be, basically, employers have to make an accommodation to any high-risk person to not have to go back to the workspace. And so you're going to be that person that's going to need to have an accommodation made for you. I'm a speech language pathologist and I'm taking Remicade. I cannot use a mask. You can't. Yeah. Boy, Nancy, that's tough. That's really tough. I don't know what to tell you. You know what? And actually, we were talking about that with my team. I wouldn't be so sure that working like this, you see how close I am? I think you can do virtual just as well because you can't wear a mask. And we were talking about that with my team because Dr. Yee was saying in our meeting, even if we started seeing patients in person, we're all wearing a mask. You're going to wear a mask. It's going to take away from the interpersonal connection. Like if I'm one-on-one with someone, look how close I can move to the camera. With a good setup, the person can see very clearly what I'm teaching them. And so as a speech language pathologist, you're going to have to find a way to do it with a camera. And I believe you'll be able to. So you're going to have to make that jump to teaching people this way. And because doing one-on-one with a mask is not going to work. And so you're going to have to pivot and not feel so bad about it, because I actually think even if I wasn't doing speech language, just the interpersonal connection of sitting in an office 6 feet apart, at least with the patient and us both wearing masks, I think that's less connecting than sitting like this very close in a video. I've been doing video with everybody that way. All right, I got to wrap this up. I have my team meeting at 12:30. Okay. I have a respiratory condition where I have phlegm and I cough a lot, and that also causes nasal congestion. This is normal for me. Does that mean no? Claudia, I just answered sort of what I said to other people. Chronic, people with that chronic stuff, no, we're talking about like a new cold, okay? How about protecting the eyes? It seems that protecting the eyes when you're just out and about doesn't seem to be the big thing, but you certainly can wear sunglasses and that will protect your eyes, so not a bad idea. It's really like healthcare workers or people in high exposure areas should definitely protect your eyes. So I do wear glasses when I'm out, so good idea. In the UK, we've been told on plastic surfaces holds longer, so at petrol pumps, I've been wearing plastic gloves, filling it up. In one hand, holding my keys yes, we all have a way we figured out how not to cross-contaminate. I put my keys in my pocket and my credit card in my pocket. No, keys in my pocket, use gloves, do the whole thing. And then I have my wipes and I wipe down with my gloves still on, I wipe down the credit card, like rest it on the chair, and then take my gloves off, wipe my hands down again, and then, wipe the credit card down again and get in the car, but we all have our ways to do that. So sure. Do you think a 9-year-old boy can wear a surgical mask? Of course. Oh, you asked me that already. What is your view on visiting other family members or friends for overnight stays, assuming they've self-quarantined? I'm fine with that. I think that's the next logical step. As I told you, my niece and her kids are going to go stay at my sister's for the first time. They're going to come. They've been quarantined just like her for the past 2 months. So I think you can expand your circle, but again, you have to have that circle of trust that everybody's been quarantining. Also, takeout. How safe is this? Like, what if the chef sneezes on the food? The chef is wearing a mask, so he's not going to sneeze on the food. I can't promise that, right? But it's their livelihood. They have rules they're following. They're all masked up in the restaurants, and so if someone with active COVID at the restaurant, sneezed on the food, that's not good, right? It's still better to swallowing it than inhaling it, first of all. Because your stomach acid should disarm the virus. But that being said, you should call any restaurant that you're thinking of taking out. You can call them and ask them what are the processes they have in place to ensure the safety of the food, and let them tell you. Are they wearing masks? Are they screening their employees? Are they asking them questions? Are they making sure sick people don't come to work? Are they taking people's temperature, right? So you can ask to reassure yourself. If we have family members that have been positive but are symptom-free, are we okay to be around them when stories, especially people getting it twice? People are not getting it twice. We think that they turn sort of negative and then there's some virus that's sort of lingering in their body. We think those are people who just never cleared 100% the virus. But it appears that 2 weeks later, 3 weeks later, if there are some people that are persisters that still have some virus that you can culture from them, they don't appear to be very contagious, those people. And so like the amount of virus particles are very low. And so the level of contagiousness is very, very low. And so that is a little bit of a question about family members who are positive but symptom free. I think the rule of thumb is 3 weeks. So 3 weeks from onset of symptoms. Even for the persisters, I think you're pretty safe being around those people. So 3 weeks from when their symptoms onset, or a week after they were completely done with any symptoms whatsoever. And so there's some stories of random, and I think I know who you're talking about, who asked that question, but there are some people who are persisters. And those tend to be the older people who have poor immune systems, who are not clearing the virus that easily, and it persists a little longer. But again, by day 21, even if there's a little virus, they're very low contagiousness for those people. Do you feel hospitals in Westchester are well-versed in latest treatments and cutting-edge research on COVID, some more than others, or would we be better care? I don't really know the answer to that. I've been trying to find who's got remdesivir for treatment. I'm on staff at Greenwich Hospital, so I've been, I see exactly how they're treating people. So for me, I would go to Greenwich Hospital because I'm on staff there, and I get the weekly, I know exactly their whole treatment algorithms. I know how many people are in the ICU there. So Greenwich Hospital has plenty of capacity. They're doing really good. They're part of the remdesivir study, so they can use it if you go into the ICU. But I don't know other than that. You just want to make sure they all have beds, and right now Greenwich Hospital does. But I don't know. I don't know. If you could find, like somebody said, if you can find a hospital that does IV vitamin C, that would be my number one choice. But I've Googled it and I've been unable to find who's actually doing that. Can you run through the list of screening symptoms again? The screening symptoms are fever, cough, sore throat, shortness of breath, loss of taste and smell, and like a new cold, nasal congestion and runny nose. Okay, those are them. And how do you handle staff at a store with mask below the nose? If it's my staff, I tell them that it's absolutely unacceptable. How do you handle staff at a store with a mask below the nose? If it's a store you're thinking to go into, you're not going to go into the store. So, we have to all be very comfortable reporting people that are not following the guidelines. So if you're a customer, then that's not a store you should trust. If they're your employee, they have to follow the rules, or you're going to have to let them go. There's culture that everybody has to buy into. Oh gosh, guys, it's 12:30. I have to go. So I'm not gonna be able to answer all of these. So I'm not talking about diet, but an anti-inflammatory diet absolutely is really good for the immune system. Wouldn't people be protected? Oh, this is about mutation. Right now, it's not mutating enough where we're concerned about it. I hope it mutates and becomes not as contagious and not as deadly. Um, so we know you're protected from this version. That is true. And if it mutates a lot, it's possible your immunity won't protect you from a mutated version of the virus. So that is true. So that's another reason to still follow all the guidelines, even if you've had it. Should the disposable surgical mask be woven or unwoven? Um, they're cotton, I think. Or they're poly. I was reading about what they're made of. They're made of a synthetic substance, and I think it is like a woven synthetic substance. But I'm not an expert on that. But they should be. There's a certain kind that are called a surgical mask. They're blue on the outside and they're white on the inside. It's a double layer, but it's a polyurethane. It's a synthetic material. It's not cotton. How valid is COVID screening if your employer requests a negative test? Oh, it's valid. COVID screening is actually pretty good. And especially you should do one that combines saliva with the nose. The COVID screening, I think, is pretty okay. You want to do one that isn't just a quick test, which is the one they're using in the White House. Is colloidal silver useful? I'm not familiar with, I don't use colloidal silver, so I don't answer the questions about colloidal silver. There are a lot of disposable paper masks for sale. Just look for one that's called a surgical mask, okay? Like I said, I got mine at Walmart online. Stairs or elevator better to mitigate exposure? Definitely stairs. Elevators, no more than 4 people in an elevator, or go by yourself, but there are buttons and there's air. So I would probably say stairs if you can, but if you have to go in the elevator, that's fine. Just wipe everything down. Don't use a tissue to touch the button. Wear a mask, and just be careful. Temperature threshold for keeping people out. Any temperature, 99 and above. Are you writing a new book or booklet to help at this time? Good question. I've thought about it. And if I haven't, it looks like my practice is very slow right now. I might have time. So I might. I'm thinking of writing a little booklet. Yeah. So what is your cutoff number for the pulse oximeter? Oh, so definitely below 90, for sure. But that's a good question. Below 90. I came in late, so apologize. Local hospital addressing the new info about blood clots. They're really doing it. They're using blood thinners. Yes, blood thinners are part of the new treatment protocol. The strange COVID that's seen in children, vasculitis. I have an adult patient who I think developed vasculitis 2 weeks after she recovered. And so I think vasculitis is this sort of symptom now we're seeing in adults as well that we're learning about. But it's treatable, which is good. Okay, I'm sorry. I wanted to get through it all, but I'm not going to be able to. You guys, you just have too many questions for me. So, maybe what I'll do is we'll find a way to start a Facebook group or do something else to do questions and answers. We could do this forever and ever, it seems. But I'll be back. So save your questions. I'm just not going to be here next week, but I'll try to hop on the following week. So just stay tuned for an email that'll tell you when I'll be back. Okay. I'm just definitely not going to be here next week. And then we'll go after that. I see there's still a lot of need, and for you guys, you have a lot of questions. And if you're a patient of mine, schedule a visit. I've got space in my schedule, and please come and see me soon, and especially if you have any very specific personal questions for yourself. So take care, be well. I will be back. It's just not going to be every week. Okay. Talk to you all soon. Stay safe and stay home for now, and go outside.